Adhesive capsulitis of shoulder. It is also known as frozen shoulder. Here is difference between the normal shoulder and frozen shoulder. Anatomy. Types of movement occurring at the shoulder joint includes flexion, extension, abduction, adduction, internal medial rotation, external lateral rotation. Frozen shoulder. Definition of frozen shoulder refers to an inflammation conditions of the shoulder presented by pain and reduced range of motions of the shoulder. A patient also presents with stiffness of the shoulder that progresses over time leading to loss of motion at all planes, characterized by progressive pain and stiffness which usually resolves spontaneously after 18 months. Etiology. Causes of frozen shoulder. The causes of condition is classified into primary and secondary. Primary, idiopathic, that is no clear cause. Secondary involves immobilization, diabetes mellitus, hypo and hypothyroidism, autoimmune conditions, trauma, history of cervical disc, and advanced age. That is age factor is included. Stages of frozen shoulder, freezing phase. In freezing phase having pain, frozen phase having stiffness, and thawing phase having reductions of the shoulder joint. Freezing in freezing phase, this takes place from 2 to 9 months. There is an insidious onset of pain with progressive loss of motion. It's characterized by synovitis that progresses to capsular thickening, particularly in the anterior and inferior portions of the capsule, with an associated reduction in the synovial fluid. Frozen in stiffness adhesive phase lasts between 4 to 12 months. Fibrosis of the capsule is more pronounced and the thickening of the rotator cuff tendon is common. There is pain with progressive loss of motion. Thawing phase. In thawing phase, resolution phase takes place in about 6 to 9 months. There is pain, resolutions, and complete range of motion is gradually attained after 1 to 3 years. The pathology. Every joint is covered by a capsule that is made up of with the lining known as the synovium. Inflammation of the synovium, that is also called as synovitis, is the initial cause of pain. Fibrosis in the process of the tissue repair brings about the reduced range of motions. Diagnosis. Diagnosis of the frozen shoulder. The condition is a clinical diagnosis that is diagnosed, clinical presentation, and the physical examination. Clinical presentation. Gradually onset of progressive pain. Pain worsens during night. Awakens from the sleep, especially when lying towards the affected shoulder. Reduced range of motion in all planes. Difficulty with activities of daily living such as tucking in shirt, fastening a bra, and combing hair. Complaints of neck pain and the pain down the arm. Pain put stress to the neck. Physical examination. Measurable reduction in both passive and active range of motion. The external rotation is marked restricted. Abduction is restricted. Flexion internal rotation is restricted. We continue. Like, share, and subscribe.